Question number 5. A 14-year-old girl presents with sudden drooping of the right side of her face with drooling and excessive tearing. The patient's mother says the patient was recently in the northern Maine and spent most of her time during the trip outdoors. Physical examination reveals a slight asymmetry of the facial muscles with an inability to whistle or close the right eye. A circular red rash with central clearing is present on the trunk. There is also a decrease in the taste sensation. Which of the following most likely transmitted the organism responsible? Was it the Ixodes scapularis, the CC fly, Culicidae, Dermacentor, or Anopheles mosquito? This was pretty giveaway. I would say the rash is very, very typical. The circular red rash with the central clearing. This is a giveaway along with signs of facial nerve involvement, drooping of the right side of the face, inability to whistle, all of this indicating facial nerve palsy. Okay, so these two features gives away the diagnosis of Lyme's disease. So this patient is most likely suffering from Lyme's disease, which is caused by Borrelia, a spirochete bacterium. It's transmitted by the Ixodes scapularis, a species of the deer tick, which is endemic to the northeastern United States. It initially presents with an erythematous rash with a central clearing and non-specific constitutional symptoms like fever, myalgia, malaise, arthralgia, and it can involve the nervous system causing Bell's palsy, as in this patient. Untreated Lyme disease may also cause heart conduction abnormalities, AV block, arthritis, usually later in the disease course. Okay, so here they've just summarized some of the symptoms that we can see with this infection. So that would be headache, hearing loss, paralysis of the face, muscle soreness, erythema, migraine. So this is the target rash that you see. Heart complications and other non-specific symptoms. So I think someone had answered CC fly. So this presentation of the rash with facial nerve involvement is very typical of Lyme's. CC fly is the vector for trypanosomiasis. Okay, so just keep that in mind. Then Culicidae is a vector for multiple tropical illnesses. Dermacentor, the Dermacentor tick is an American dog tick, which is a vector for rickettsia, which causes Rocky Mountain spotted fever. Okay, and the female Anopheles mosquito, you all know, causes malaria. So let's quickly go over this one table that we have. Okay, sorry. For Lyme's disease. Okay, so let's go over this table. So Lyme's disease is divided into 3 stages: early localized, early disseminated, and late or chronic stage. The early localized stage is where you see the target rash. So look at this rash. It starts off as a reddish macule, and then there is central clearing. So it looks like a target. So this is seen in 80% of the patients, along with constitutional symptoms: fatigue, malaise, lethargy, headache, neck stiffness, myalgias, arthralgias. Then the early disseminated, there will be cardiac involvement with AV block and cardiomyopathy. Just remember the AV block, very high yield cardiac involvement for the early disseminated phase. Neurologic will be unilateral or bilateral cranial nerve deficits, usually cranial nerve 7, meningitis, encephalitis. So I would recommend remembering bilateral facial nerve palsy. That is how they usually present it to you in your question stems, bilateral facial nerve palsy. And yeah, if I'm not wrong, even first aid, they mention it as bilateral facial nerve palsy, and they've also given you a mnemonic there. So that would be super helpful to remember. Muscular, migratory arthralgias, conjunctivitis, skin. Okay, so one thing you need to know is that in the early localized phase, it will be a single lesion, but early disseminated phase will have multiple erythema migrants. Okay, so that is also very highly to remember. Late chronic will be muscular, like arthritis, and neurologic findings are predominantly seen in the late phase. That would be the encephalomyelitis and the peripheral neuropathy, but the bilateral facial nerve palsy is seen in the second phase. And here you can see it's very important to also pick up that clue of the you know, they'll give you a history of outdoor activities. The region will be the northeastern United States, predominantly Connecticut, and in this case, they're given a history of Maine.
Thanks for watching. Please give a thumbs up and subscribe for more.